Hey guys, it's Dr. Hub. Today we'll look at the acute leukemias and the focus is on the cytochemistry. So under this we will look at the stains. And we'll be comparing the AML and the ALL. So AML versus ALL. So in the stain we see myeloperoxidase. So in terms of the myeloperoxidase, the AML is going to be positive and the ALL is going to be negative. Then comes the Sudan black. So under the Sudan black, the AML is again going to be positive and the ALL is going to be negative. Next, let's look at the non-specific esterase. So under the non-specific esterase, the AML, what does it have? The AML, there is a strongly positive. So AML is strongly positive and this contains a M4, M5. Then comes the weakly positive. This is weakly positive, and what does it include? It includes M3 and M7. Now we look at the ALL. So ALL is negative. Then let's look at the PAS. So PAS stands for the periodic acid shift. So it is a periodic acid shift. So this is in terms of the AML, it is going to be positive, and this is the AML M6. Then looking at the ALL, the PAS is going to be positive. Then comes the acid. We look at the acid phosphatase. So acid phosphatase in terms of the AML is going to be negative. And then when you look at the ALL, this is going to be positive. This is with a T cell.